So maybe just to end things off, Brian's brought up health equity as something that's incredibly important that we need to look into, or needs to be part of the conversation. So maybe the closing question is, with the formation of new CDA, what's the one thing you hope it can help with in terms of improving health equity? Maybe we'll start with Sang-Min and we'll end with Brian.
Thanks. Yeah, so for me, I think the fact that we're trying to, through CDA, sort of better capture the data, that actually means also trying to better capture the data of those subpopulations or the populations that we really don't generally ensure that, like we are sort of making sort of well-informed decisions about. So I want to, I would really hope that CDA is going to help, gather the right data across the whole Canadian population, right, with a focus around that equity as well, and so that we can make the best decisions for all Canadians.
I'm going to just start by talking a little bit about the organization that you mentioned I'm president of, which is ISPOR, International Society for Health Economics and Outcomes Research. The P in there is about pharmacoeconomics, but we've basically it's about health economics and outcomes research. And annually, or actually, I guess it's about every 2 years, we put out a top 10 trends list, and we've just released our top 10 trends for 2024, 2025. Number one is real world evidence, by the way. And within that, number five is health equity. Health equity is crucial. And my role as president, I'm the board chair for ISPOR. It's an unpaid role. And we've made it very clear in our board discussions that we need to embed health equity in everything we do in ISPOR. And I think that's exactly what Suzanne and the team at CADTH will do as well, is ensure that it's not an afterthought, it's not just an add-on, it's embedded in our thinking that we do have to consider the rural and remote areas of Canada. We have to focus in on marginalized and racialized populations. There's a great opportunity and a great responsibility for all of those who work at the Canadian Drug Agency to ensure that we focus in on health equity.